Hi there, it's Lisa here from Oakley Physio, and this is just a little education video for pregnancy and pregnancy related pain. It's just to try and explain to you a little bit about what I tell most of my pregnant patients who come to see me with pelvic pain or low back pain, just to explain the reasons why and what you can do about it. So I brought along this pelvis, okay, and this is positioned where you would put your hands on your hips. That's where I would put my hands on the top of my pelvis, okay. So these big bones here, this is called the ilium, and then this bit at the front here is called the pubic bone or the pubis, and this bit here where it's joined together is the symphysis pubis. So it's just, if you get any of these words said to you, then you'll understand where these are referring to. You've also got this bit here at the back, that's called the sacrum, and at the bottom of the sacrum is your coccyx. So you know about it if you have ever fallen in the ice and landed on your bottom, or you've fallen backwards and landed sort of on the base of your spine and bumped your coccyx. It's pretty sore. But these joints here are the sacroiliac joints. So you might again hear these being referred to, and your sources of pain in the pelvis are generally the joints. So sacroiliac joints, 2 of them, and then you've got your symphysis pubis, which is the joint at the front, and the pelvis kind of sits like this. So these bits here are the bony bits that you feel at the front of your pelvis, and then underneath is where you sit on your sitting bones, your sits bones. So actually you sit with your pelvis in that position, and you can feel where you're sitting, the bony bits that you can feel underneath, that's those bits there. And then those 2 sections here where there's these round sort of concave bits, that is where your hip sits. So the long bone, your femur, comes up and sits into that socket. That's your ball and socket. So the top of the femur, the long bone that comes down your leg, your thigh, is like this. The ball part fits into this socket in here. Now, what are these things, these red bits in the middle, and what are these blue bits that we can see on the outside? So these are your ligaments, and your ligaments hold everything together, and they hold the bony parts together. Whereas your red bits here are your muscles, and these are your pelvic floor muscles. So your ligaments can be a little bit more flexible, a little bit more stretchy when you are pregnant, and that's because your body is producing relaxin, one of the hormones that's produced during pregnancy, to enable the pelvis to expand and to enable your body to change and adapt to the growth of your uterus, and therefore the growth of your baby inside your uterus. So if you didn't have that relaxin, your ligaments wouldn't relax enough to stretch. However, sometimes the amount of relaxin is maybe causing too much of a sort of shift in your pelvis, because the ligaments are not holding everything together. In reality, so this is being held with a screw here, but in reality the ligaments hold this together. There is no screw, and in reality there's no screws here either. The ligaments are just attached to the bones, but these screws allow me to be able to peel off layers to show people what's going on inside. But what I want to show you is that you have muscles here called the pelvic floor muscles, which are the floor of your pelvis. They surround, that's the back passage, the vagina, and the urethra, which is what you wee through. So you've got the 3 passages that come through the muscles, and those are very, very important to give you some support from underneath. Now, the thing that's not shown here is you've also got your tummy muscles. You've got lots of layers of tummy muscles. You've got your deep transversus abdominis layer, that's your sort of corset-like muscle that wraps all the way around. You've then got oblique layers, so you've got some fibres of your obliques running this way and fibres running that way as well. And you've also got your six-pack muscles, which are down the middle. Now, I don't know if anybody's heard of a diastasis rectus or diastasis, as some people, more Americans, tend to call it diastasis. But basically, if you've got your six-pack muscles sitting here, sometimes what happens, and you might see this with your pregnant tummy, as you move, you get some doming. Okay, so it tends to kind of come up like a peak as you look at it, especially if you're trying to lift your body forwards from a lying down position and you're getting yourself maybe off a couch and you've been lying back. If you pull yourself forward, that doming that you get, that's because the muscles are held together by fascia. So say, for example, you've got your biceps muscle with this one at the front here, it's attached onto bone with a tendon. So you've got your calf muscle here, it's attached onto bone by your Achilles tendon, that big thick bit that you can feel at the back of your ankle. So instead of having a tendon which is attached onto the bone, these muscles attach onto each other using fascia, which is like the tendon. It's that join bit in the middle. And you can see sometimes as you get more pregnant, you sometimes have a line down the middle, like a brown sort of line. And along that line is where you've got your fascia underneath, but sometimes that fascia will stretch and stretch and stretch. And when you're then, once you've had the baby, it should come back in, but sometimes it doesn't come back in straight away, depending on how much it's stretched and how people have got different types of collagen and how good it is at coming back to what it was before. Just like some people get more stretch marks and some people don't. It's just one of those things, and you can't really tell what you're going to be like. Okay, so what can we do to try and help these things? The reason that you've probably started watching this video is because either I, as a physiotherapist, have pointed you in the direction to get more information, to give you a bit more education, and also to help you with pain relief. So if you are struggling with pelvic pain, there are certain things that you can do. And one of the things that you can do, and one of the things that I can do for you as a physio, is put my hands on you and adjust things to try and make them more symmetrical. So that's what I can do from a one-to-one level. But if you can't come and see me, or if you don't want any hands-on treatment and you want to see what you can do for yourself, then here are a few tips that I'm going to pass on to you. So firstly, get your pelvic floor working for you. And the way that you get your pelvic floor working is to get some really good deep breaths. So you get your breathing right down into your diaphragm. You take a deep breath in, into your diaphragm, dropping down. And as your diaphragm comes back up, it's allowing you to breathe all the way out. And it's really important, I can't stress it enough, that you get a really long breath out. You empty your lungs with as much as you can to then allow you to get some fresh, good air in that's full of oxygen. Because if you're not getting rid of all the air that's in your lungs, then you're keeping too much sort of residual volume, and you're not getting enough oxygen pumping around your system. So if you want to get loads of good oxygen to your baby and loads of good oxygen to the rest of your system, you need to take some nice deep breaths. So you could do a little bit of meditation, maybe 5 minutes at a time, just sitting, chilling with some nice music, even closing your eyes, just sitting nice and relaxed with some cushions around you, or even sitting on your gym ball. You don't have to close your eyes, you could sit and just sit with a good posture and breathe and just focus on your breathing. That's going to be really, really good for later on when you're coming to your labour as well. So breathing, getting the breathing right down into your diaphragm, dropping down, putting some pressure on the pelvic floor, and the pelvic floor will work as a result of that. So without even thinking too much about what your pelvic floor is doing, if you get really good deep breaths, your pelvic floor will work with you. So if you're really wanting to focus on pelvic floor, you want to sit in a good position with a neutral spine. So those bony bits point directly forward. So you don't want to be rocked under like this, and you don't want to be tipped so forward like this. If I show you sideways on, you don't want to be like this and sitting squashed where your tummy is just all squashed in here. And you don't want to be too far back there with your bottom stuck out and a really arched back either. You want to try and get your rib cage so that it's over your pelvis, and that your pelvis has the bony bits at the front pointing directly forwards like headlights on a car. Then you're thinking about what's going on underneath. So you breathe in, and as you breathe out, you draw up inside. Now you tighten back passage, front passage, and everything in between. So it's a tightening and a lifting up inside. You're lifting up towards your diaphragm, towards your tummy, and then breathe in again, and then breathe out and let it go. Okay, if you can't hold it for that long, then breathe in, then breathe out to draw up, breathe in to let it go. So breathe out, draw up, holding that drawn up feeling for that whole breath out. And if you're doing a long breath out, that should be a good 6, 7, 8 seconds, maybe even 10 seconds. We'll see in a second how long I can hold it for. And then relax the pelvic floor again when you breathe in. So if you take a breath in first, I'm not going to talk now, I'm just going to count. As I breathed in there, I've let my pelvic floor relax. Now as I breathe out, and I counted for 10 seconds on my fingers, that was me holding the pelvic floor, drawing up. And as I breathe in again, I'm letting it go. And as I let it go, I'm completely relaxing. Now, nearer the time that you're due to have your baby, then you may want to do a little bit of squeezing the pelvic floor and then letting it go completely, and then just letting it push down a little bit further. And you may want to do some perineal massage. There's lots of things that you can do in preparation, and you can have a look at those kind of things at a later stage. But during the pregnancy, and trying to get the pelvis to be a bit more kind of controlled and create more stability around your pelvis, if you've got pain, then the main thing is that you get some stability and some strength and some drawing up sort of feeling with your pelvic floor, and then let it relax each time. Don't be holding loads and loads of tension in the pelvic floor all the time. That's not good for you either. So it's getting that balance right. Now the other thing is your deep tummy muscles that wrap all the way round and connect in with your deep back muscles as well. And I've been sitting while I've been talking to you on this gym ball, and this is an ideal way of getting good posture for short periods of time, not for any length of time. You don't want to be sitting on a gym ball for 2 hours watching a film, but just using it for 20 minutes, half an hour at a time. And you can do some exercises, which I have shown you on a couple of other videos, but we will come to that again. So with your tummy muscles that are stretched, you can still use them. So drawing in with your tummy, so a sort of pulling in, and with that sometimes the bump will sort of come up into your sort of lifting up towards your rib cage. It's kind of like you're giving that belly a hug, you're giving your baby a hug inside. You don't want to shrug your shoulders up, so you want your shoulders to stay relaxed, but you're sort of scooping and lifting, and that works quite well with the scooping and lifting underneath with the pelvic floor. Now another way that you can do this sort of scooping is to work with pelvic tilting. And if you are having pain on one side and you feel that you need to have some sort of manual therapy, a bit of adjustment, a bit of making you a bit more symmetrical, then once that's done, then this is a really important thing to do to try and get the muscles to give you that support and work when you are in between appointments. Or you may find that being adjusted once allows you to carry on with gentle exercises like this and not have to see somebody like me again. Okay, so this is why I'm giving you this video to try and give you that ongoing treatment, if you like, and help you with you know, managing your own pain and managing your pregnancy. Okay, so little tucks forward and back, little circles round one way and round the other way, and you could do side to side. Anything that you're doing to one side, try and do to the other side. So you don't want to keep doing lots and lots of movements one way and then feel that you're getting pain on one side. So you want to make sure you sort of do little swings from side to side. You could do a figure of 8, so you're getting your legs and your tummy just helping you control that movement. Keep it slow. And then just keep thinking about good posture and your deep breathing. Okay.